Thank you. All right, so chances are, if you're in this room and you are struggling with weight loss, the inability to lose weight, if you have anxiety, depression, insomnia, your hair's falling out, you likely have been diagnosed with low thyroid, or you haven't been diagnosed with low thyroid yet, but the chances are that you have an issue with low thyroid. Now, I have been practicing in private practice for about 23 years, and I've helped about probably over 10,000 women overcome these symptoms. And I have come to one conclusion, and that conclusion is our current healthcare model has it completely wrong. And I think that's been a theme of all the other practitioners that have come up here. And I think one of the major issues that we're dealing with when it comes to low thyroid is that we are looking and taking a very myopic approach. So all we're doing is we're looking at the thyroid, and the body does not work in separate compartments. So what I wanted to do today is kind of go through what's being missed and what is it that you can do to start your journey to really healing all of these symptoms related to low thyroid. So one of the biggest issues is that the number one cause of low thyroid is actually an autoimmune condition called Hashimoto's. It's not even a primary thyroid issue. And most of the time when you go into the doctor and you go in and you say, oh, I can't lose weight, I can't sleep, I've got anxiety and depression, they're like, oh, you must have a thyroid problem. So they run your TSH. And that's pretty much all they ever run is the TSH. And if you're lucky, they may run a thyroid panel which has a total T4, a TSH, a T3 uptake, and an FTI. But their clinical decisions are pretty much only based on the TSH. And they increase and decrease your thyroid medication. If the symptoms don't resolve, they may try to change the different type of medication that you're on. So maybe you've tried levothyroxine, Synthroid. Maybe they get fancy and they do a compounded T3, T4. Maybe they put you on Armour thyroid or NP thyroid. But most of the time, the thyroid symptoms do not change because they are only looking at the thyroid. Now, our medical system is set up so that you go to the endocrinologist when you have a thyroid problem. You go to the endocrinologist when you have a blood sugar problem or diabetes. You also go to the rheumatologist when you've got an autoimmune disease. You go to the cardiologist when you've got a cardiovascular disease. And everybody's looking at these separate systems as if they work independently. But the body communicates together so quickly you can't even understand. It's like in the quantum is how quickly our cells are communicating with each other. Your cells and your physiology starts to change with a thought alone. So it happens so quickly. And so we have to look at the body as a whole and understand that it all works together. And one of the main reasons that we're failing is because we take a single approach or we look at a single organ to try to change chronic disease, and that doesn't work. So when we're dealing with autoimmunity, the main cause, number one cause of low thyroid is Hashimoto's. 90 to 98% of people with low thyroid actually have Hashimoto's. And what that means is your immune system is making antibodies that are tagging your thyroid tissue for destruction. Now, 20 years ago, when I was working with patients with Hashimoto's, myself included, nobody really knew what Hashimoto's was, and it was like this weird Japanese word that they'd think I was speaking English. But now, most people know about Hashimoto's. If you're in the thyroid kind of community, everyone's like, yeah, I've been checked for Hashimoto's, and yes, I have Hashimoto's. But the treatment doesn't change. They still give you thyroid medication, and then they're going to give you the medications to treat all the other symptoms, right? So here's an antidepressant, here's an anti-anxiety medication. oh, by the way, we all have insulin resistance, so now when you get diabetes, here comes all of the diabetic medications. So when we're dealing with Hashimoto's, you have to understand that you have to balance the immune system. That is the only thing that is going to handle and resolve all of the symptoms that you're dealing with. And it's extremely important that we get the immune system balanced, because once you have one autoimmune disease, you're at risk for developing multiple autoimmune diseases and cancer. Thyroid cancer specifically your risk for thyroid cancer specifically goes up when you have Hashimoto's. But if you have any other autoimmune disease, your risk for all other cancers goes up dramatically. Why? Because your immune system is out of balance. So how do you balance the immune system? So you have to look at the body as a whole, and you have to understand what are the triggers that are causing your immune system to attack the body. And there are very common triggers that we see in clinical practice, but everybody is going to be different, and you have to address the triggers that you're dealing with on an individual basis. But let's talk about the major triggers that we see with autoimmunity. Can anybody guess the first thing? It's insulin, right? Insulin surges will cause the immune system to attack the body, to attack the thyroid if we're talking about Hashimoto's, right? You absolutely cannot stabilize your immune system if your blood sugar is not regulated. I have so many people come to my office. Well, I'm not in an office anymore since COVID. We are now virtual. But I see so many people, and I'm never the first doctor. I'm doctor like 10, doctor 20. And I'm like, okay, let me see all the stuff that you've done. And they've done all these crazy things. Not yesterday, maybe 2 days ago, I saw a lady who'd done ozone therapy. She had done all kinds of stuff. I'm like, you have prediabetes. Like, nothing's going to happen unless we fix your blood sugar. All right, so blood sugar is number one, because every time you have that insulin surge, which is why it's not good enough just to have a healthy blood sugar response, right? Like, I have a lot of doctors that say, oh, your blood sugar's fine. You saw a blood sugar spike after you ate, and it came down 2 hours after you ate, and that's normal. Well, it might be normal, but that insulin spike, that blood sugar spike, actually just triggered your immune system to attack your body. And one of the ways that you can also know if you have a blood sugar issue is if you have a weight issue at all, then you will have a blood sugar issue of some sort. Now, I'll talk about a little bit more about that in just a minute. But blood sugar is one of the biggest and one of the most basic and foundations that you have to stabilize in order to stabilize your immune system. So if I'm talking about Hashimoto's and you don't have Hashimoto's or a thyroid issue, I know many of you have other autoimmune issues also, or in addition to. So this also applies to all autoimmunity, whether I'm talking about like MS or lupus or RA or Sjogren's or whatever it is. And it's very often that I will have patients that they come in with Hashimoto's, and then we're looking down their history and, oh yeah, I have lupus also. Oh yeah, I have RA. So these autoimmune diseases there's not usually just one, there's multiple. So your blood sugar is huge. Number two, your hormones play a big role. When you have estrogen and testosterone surges, you can trigger the immune system to attack the body. The other thing, which Dr. Kills talked about earlier, is pathogens. So when you have underlying infections, we're talking about bacterial infections, viral infections, and parasitic infections, that will cause the immune system to also attack the body. When you have autoimmune diseases, your immune system will be out of balance, and it doesn't efficiently and effectively handle these underlying infections or pathogens. I will say probably 70 to 80% of the people that I see have some kind of underlying bacterial infection, viral or parasitic, and you don't even know that you have it because they are low-grade chronic infections. So mostly like the bacteria, they will be deep in our sinuses. We will see it in your teeth and your gums. We will see it in your gut. And you've been walking around with these infections for a very long time. And like he said, Lyme as well, they'll have a lot of co-infections and bacteria that accompany Lyme. The other thing that's really important, that's another trigger, is biotoxins. Now, this is starting to get the buzz if you look on Instagram. I've been working with patients that have biotoxin illness for almost 10 years now. And when you hear the word biotoxin, essentially it's a toxin that comes from a living organism. And for my patient population, which is mostly autoimmune patients, probably 80 to 90% of them genetically cannot clear biotoxins or mold. All right, so I test everybody genetically. The gene test, if you want to know, is HLA-DRDQ. And essentially we'll say, do you have an issue clearing out mold? Do you have an issue clearing out different biotoxins that would be considered multi-susceptible? That means you don't clear out mold well, you don't clear out Lyme well, and there's a list of other biotoxins. So like rattlesnake venom is another biotoxin. The venom from a recluse spider is another one that we'll have issues with. So these biotoxins keep circulating in your system. They cause inflammation, they cause brain fog, they cause chronic fatigue, and of course they stimulate your immune system to attack the body. The other thing that's really crazy about biotoxins is they can sit on insulin receptor sites and create insulin resistance. So sometimes we do everything right with our diet, and we're like, why am I still insulin resistant? Why do I still have a weight problem? But what we need to understand is that blood sugar and insulin resistance is not just dictated by the foods that we're eating. So can you fix a blood sugar without fixing your diet? No. But once you fix your diet, if you still have a blood sugar issue, you've got to look at underlying pathogens and biotoxins. Because when you have an infection, it raises your blood sugar. When you have these biotoxins, they can sit on insulin receptor sites and really impact the insulin resistance, or how much insulin it requires to get the sugar into the cell so that your mitochondria can make energy. The other thing with biotoxins, I could literally talk for probably hours on biotoxins, so I'll try to keep it quick. But biotoxins are really important because they actually cause a very specific part of your brain called the cingulate and the basal ganglia to downsize. And what that causes is you will forget words in the middle of sentences. It will be hard for you to focus and concentrate, and hard to retain new information. And it's really cool because we've been able to do pre and post volumetric MRIs, and after 9 months of getting blood sugar regulated, working on all these triggers and decreasing the toxic load in the system, you actually see a significant increase in that part of the brain, and the symptoms go away. And so you can actually reverse cognitive decline if you catch it early enough and you handle all the underlying triggers. All right, so we've got insulin resistance or insulin surges. You've got dysregulation in hormones, whether it's an increase in insulin or surges in testosterone. We've got underlying pathogens. We've got biotoxins. And we can't forget about food sensitivities. All right, if you're eating carnivore, you're probably decreasing about 99% of food sensitivities in the body. But for those of you that aren't carnivore or aren't keto, a lot of times we have so many food sensitivities, we create all these antigens in our body, it creates inflammation, and the immune system can never calm down. And then the other thing we have to think about is our gut health, right? Because your gut health plays a huge role in your immune health as well. But this is the thing, so many people focus only on gut health. And if you only focus on gut health and you didn't fix your blood sugar, you're never going to fix your gut, because the bacteria in your gut respond to the sugar that's floating around in your bloodstream. So it doesn't matter how many fancy probiotics that you take, you're not going to fix your gut health until you fix your blood sugar and all of those other things that we've been talking about. Now, the other thing that I think is really important is when we're talking about thyroid health, most of the time, and I mentioned it earlier, they're only checking the TSH. So the TSH is, interestingly enough, not even made by the thyroid. The TSH is made by the pituitary to tell the thyroid to make thyroid hormones. And there's actually 12 different markers that we use to understand thyroid physiology. So also it's important that you understand that thyroid physiology pretty much does not even happen in the thyroid. So the thyroid, the gland that sits right here in your neck, the main purpose of the thyroid is to produce thyroid hormones. And it mostly produces T4 and a little bit of T3. After it produces T4 and T3, all other thyroid physiology happens outside of the thyroid, in the body, right? So there's a couple of things that happen. If you're not looking at all of the markers and you're not understanding what's going on with the body, you're going to miss why you actually still have all of these symptoms related to low thyroid, even though you're taking thyroid medication. All right, so one of the most common patterns that we see with thyroid dysfunction is that you will have an underconversion pattern. All right, so the thyroid mostly makes T4. T4 is not even really an active thyroid hormone. Your body has to convert T4 to T3, which is the active form of thyroid hormone, and that's what turns up or down your metabolic rate in the body. Now, there's a few reasons why you could have an underconversion pattern. Number one, you could be lacking all of the cofactors and the nutrients that you need to convert T4 to T3. Number two, you could have issues in the liver. So many of my patients have fatty liver, and the liver is not functioning the way that it should, and 70% of the time, T4 is converted into T3 in the liver. So we're trying to shove thyroid hormones in the body. We're trying to override body physiology, but we're not really understanding what's going on in the individual person and why is that person having this dysfunction. And the third reason that you would have thyroid underconversion, why would your body turn down the metabolic rate? Well, you could have a very high toxic load. You can have biotoxins, heavy metal toxins, environmental toxins. You can have loads of free radicals. And the body's like, hey, we have got to slow all of this down because I cannot keep up with this toxic load. I can't clear out all the free radicals that's being made from all this sugar that I'm also having to produce. So then the body's like, okay, we got to slow everything down. We become more insulin resistant. The mitochondria health is not good. But instead of looking at all of that and starting to reverse the blood sugar issue, improve mitochondrial health, decreasing the toxic load in the body, we just keep shoving the body with more thyroid hormones. And that is why we don't feel well, even though we take thyroid medication, and even if they get your TSH normalized, if you don't fix the actual physiology that's going on that caused the issue in the first place, it's going to be very hard to make any significant improvements. But when you start to look at the body as a whole, and you start to say, okay, what is going on with my blood sugar? What is the toxic load in the body? What's going on with my liver? So extensive testing is so important so that you can understand what's going on underneath the surface. And then you have to analyze it not from a disease drug therapy model, but you actually want to analyze labs from a functional or optimal model or ranges, right? So when you look at the lab ranges that you get when you do traditional labs, those ranges over there are basically, do you have a disease and what drug do we give you to handle or manage that disease process? So the way they get those labs, for the most part, those ranges, is they just take an average of the people going into the labs, they graph it on a bell-shaped curve, they take the middle, and then they go 2 standard deviations out, and they say, this is going to be our lab range. And the crazy thing is I have patients in Pennsylvania, and I also have patients in Texas, and all over, and their lab ranges are different depending on where they get their blood drawn. So as somebody here in Massachusetts, is somebody here healthier than somebody in Texas because they don't fall out of the lab range, but their numbers are different, right? So there are optimal functioning ranges that we have based on research. And I don't know about you guys, but I want to function optimally. I don't want to just wait until I have a disease state, right? So what Dr. Boz was talking about is an A1C of 5.6 healthy? Well, it's not insulin resistant. I mean, it's not pre-diabetic. It's not diabetic. But most of your doctors are not going to tell you that there's a problem, but there is a big problem, right? So the disease state, especially the diseases that we're talking about, do not happen overnight. It did not start the day that you became aware of it. It started many, many years, probably decades, before you actually get the diagnosis. And so if you evaluate your labs from an optimal range instead of the disease drug therapy range, then you're going to really figure out where are the underlying imbalances, and then what is it that you need to do to improve and optimize your health to prevent those disease processes from happening or to reverse it. All right, now, here's a few things that you can do. When I'm done, I'll put a QR code up here so that you can get a couple of different downloads. I'm going to give you the 12 different thyroid markers that make up my thyroid panel. And then I'm also going to give you, it just so happened that I have 12 markers for my dysglycemia panel as well. So I'll give you those also, along with the functional ranges and the typical patterns that we see, the typical patterns of dysfunction that I see in most people. The other thing that I think is really important, I was going to tell you that you have to balance your blood sugar. And Dr. Boz did a really great job of doing that already. And we know that going keto or carnivore is probably the most effective way of getting your blood sugar balanced. The other thing that I like to do with patients is to tell them to do circadian fasting. And that's kind of what she did as well. So a lot of people, they will fast until probably, 11, 12, 1. But it's really important that we eat within 30 minutes of you waking up, because that's when your mitochondrial activity is highest. That's when your body requires and needs the most energy of the day. And then if you will eat within 30 minutes of waking, and then maybe don't eat dinner, and increase your window later in the day when the mitochondria are calming down, when you're getting melatonin release from the pineal gland, and also leptin levels go up. So you want to make sure that's when you're going to burn, the most ketones, and that's when you are going to burn the most fat at nighttime. And so if you'll do circadian fasting, it will be more effective than if your fasting window was first thing in the morning. All right, thank you.